Enrolling in Original Medicare is pretty simple, and in fact, the easiest way to do this is to apply online at ssa.gov. Before we get started, there are several important things to remember. If you have a health savings account, Medicare start dates affect HSAs. If we haven't talked to you about HSAs yet, stop. Call us first so we can get some clarity before you proceed. If you are using your spouse's work record for premium-free Part A, again, stop now. There is a different process. Call us first so we can help get you on the right path. Next, check which enrollment option best matches you and your situation. It's going to be different if you are enrolling for the first time ever with Medicare or if you already have Part A and you only need to enroll in Part B. Either way, either of these choices is going to give you a chance to trigger Social Security benefits during the application process. So if you decide to delay taking Social Security, you'll see an option that says apply for Medicare only. Number 4, have your personal information handy. Make sure you have your current health insurance info, the date your current health insurance is going to end, and the date you want your Medicare insurance to start. If you already have Part A, also have your Medicare ID number handy. Last, if you're enrolling in Part B only because you have employer coverage, don't forget you have to have the signed CMS form ready to upload. If you're not sure about any of these steps, just stop and give us a call. We're here to help. Or if you think you'd rather go in person to complete your enrollment, just call 800-772-1213 and let them know you'd like an in-person appointment for your Medicare Part A and B enrollment app. Otherwise, let's get started. So if you already have a Social Security account, go ahead and sign in, then just hang out for a moment. We'll catch up with you in a sec. For the rest of us, if you've never been here, you're going to create an account, and you're going to do this by starting with the sign-in screen in the top right-hand corner, which is then going to open up another window. Click on the blue button that says login.gov. This opens one more window, and this will give you a chance to create your account. It's pretty easy, but it's important to remember you have to have a unique email address. Do not use a shared family account. This is because when you create this Social Security online account, it's going to be tied to your Social Security number. If you have trouble in this section, it's usually with identity verification. You might be prompted for additional info, and in some cases you might not even be able to complete the online setup. So you're going to have to make an in-person Social Security appointment. If this happens, first thing is to call SSA and get that appointment on the calendar ASAP. Then call us and let us know so we can help you stay on track with the Medicare enrollment timing. Remember, this is important because until you have your original Medicare ID number, we can't proceed with the other parts of Medicare, such as a Medicare supplemental, an Advantage plan, etc. So once you have the account set up, let's start the Medicare app. Go back to ssa.gov. Again, click the sign-in screen that now will be set up on your sign-in. When you click sign in and authenticate the final time, you're going to come back to the Medicare homepage. At this point, navigate to the Medicare menu and then select Sign Up for Medicare. Remember I said that you're going to need to know how you're enrolling. If this is the first time you're enrolling ever in Medicare, you're going to enroll in Part A and B or Part A only. Click the blue button that says Apply for Myself. If you only need to enroll in Part B, click the blue button that says Get Started. You'll accept terms of service, there's a couple more screens, and then you'll get an option to start the app. Once you click Start a New Application, you will be given a re-entry number. Write that down. That's one of the first screens that you see. Again, write down the re-entry number. The rest of the screens are pretty simple. Follow the prompts. At each junction, you'll have an opportunity to enter information and then click the next screen so that you can complete application. Be sure that you fill out every piece of information. Proceed by clicking the next button. Don't forget you'll have to enter your current insurance information, but I want you to stop at the signature page. This is the time where you want to go back and make sure that you've entered everything correctly, and the most important piece of information is making sure that your Medicare insurance start date is the date after your current insurance ends. Once you click Submit Now, you'll get a confirmation screen pretty quickly. Print that and save it with your re-entry number. In the next few days, few weeks, few months, you'll get an approval, which is great, but I don't want you to let the timing get out of hand. We have timing considerations for the other pieces and parts for Medicare. So to check this and see where you're at, go back to the SSA homepage and sign in. You'll notice that I'm pointing out here, you've got a couple of different ways to get signed in. Once you do, if your benefit has been approved, your Social Security home screen should be personalized, and you'll notice a hyperlink to your benefit verification letter. Open that up, and you'll see the magic information that gives you Part A, hospital insurance start date, Part B, medical insurance start date, and your Medicare beneficiary ID number. As I said, don't wait too long. I would say give it 7 days. If you don't have an email from Social Security, anything in your mailbox with your red, white, and blue card, give us a shout and we'll help get you started on an escalation process so we can manage that timing to get those other pieces and parts in place. So let's wrap this up. If you are confused and you need help, give us a call. As soon as you get your Medicare beneficiary identification number, your MBI number, give us a call so we can then talk about the other parts of Medicare. We're at 303-278-2278, or you can always text us or go out to our website and reach us there. We're happy to help. This is what we do.